administering a vaccine to children. Today on the COVID helpline, we will be discussing the impact of COVID on children, the post-COVID complications. We'll also discuss the safeguards that parents should keep in mind, and experts will, of course, join us to discuss all of this. Joining us today, Dr. B. Ravi, virologist and member of the Karnataka COVID Technical Advisory Committee. Also with us, Dr. Sonu Udani. She is the Director of Critical Care and Emergency Services at the SRCC Children's Hospital in Mumbai. Dr. Shiv Kumar Shamarao, consultant at the Pediatric Intensive Care Unit at Manimal Hospitals. Also with us, Kushnuma Kapadia, Senior Area Director of Marketing South Asia at Marriott International. She's a mother of two. Her 11-year-old son had developed a multi-system inflammatory syndrome, even though he had tested negative for COVID when he turned symptomatic. Thankfully, he is now out of danger. Kushnuma, Dr. Sonu Udani, Dr. Ravi and Dr. Shiv Kumar, many thanks for joining us here on CNBC TV18. Dr. Ravi, I want to start by asking you, because you've written a piece saying that India needs to not just prepare for the third wave, but India needs to prepare keeping in mind that children might be at a high risk as we move into the third wave. We're still in the midst of a very severe second wave. What is your key concern when we talk about the rise of COVID infection across children?
Thank you, Shireen, for having me on the show. My concern is that SARS-CoV is a new virus. You can get protection from it only by either getting infected or vaccinated. And during the first and the second wave, children were reasonably protected. So now going on into the third wave, the virus will seek out susceptible hosts. And to my mind, the first group that comes is children. When I say children, those below 18. I'm also saying that those who are not vaccinated in the adult pool will also be at risk in the third wave. That is why I said. And thirdly, when schools open up after second wave, there are situations where large number of children get together, so super spreading events can occur in children. Fourthly, I think it's a good idea to prepare for enough number of beds for children, review and audit the kind of intensive care facilities we have. I think we should get them ready because our children deserve that much from us. Over.
And that's a very important point that you make, that let us not be complacent. What we can see, as you point out, because of several factors, the fact that they cannot be vaccinated at this point in time makes them perhaps more vulnerable than to the vaccinated class. And hence you suggest that we should be ready in terms of creating more infrastructure to cater specifically to children as well as intensive care facilities. Dr. Udani, let me come to you now. What are you seeing at this point in time? There isn't enough data that we have access to. The last data point that we have from the Health Ministry seems to suggest that between January and April, almost 3% of the total cases reported of COVID infections fall under the age group of 10. What are you seeing anecdotally across hospitals in Mumbai, the children that you're working with? What kind of clinical presentations are you seeing?
Thank you, Shireen, for inviting me. Yes, there has been a difference this year, and 3% may be an estimate, but there are estimates to say between 3 and 13% of the total positives are children, and that actually includes children under 18. We do handle children from 0 to 18 years, and there is a significant difference in the numbers that we saw last year and the numbers that we are seeing this year, just in the 3 or 4 months that have gone by. The symptoms also are a little different. Last year, we were not even bothered much. They came, they played around, they had a little bit of fever. We gave them paracetamol, and most of the time, they were isolated because someone in their family had it or they had it, and we didn't want to transmit it to their older family members. This year, it's quite different. We are not admitting any child purely for isolation. We are only admitting children who are actually sick. Also, the manifestations are a little more severe. The fever seems to last longer. It seems to be higher in degree than it used to be last year. There is a significant incidence of diarrhea. Now, along with this, there are a very small percentage of children who have actually presented in the acute COVID situation with shock, which means that they have low blood pressure, they have a significant amount of acid in their blood, and they need not only fluids to resuscitate them, but they also need higher vasoactive medications like adrenaline and noradrenaline, which actually help to boost up the blood pressure. This is a distinct difference we are seeing this year. We are also, of course, seeing the MIS, and what we did not see last year, but we are seeing this year, and this, I would say that it's more in the 14 plus age group, is significant pneumonia, respiratory distress, and needing oxygen, high flow nasal cannula, and also ventilation. We were so complacent last year when we didn't see this cohort. This year, we are really geared up all the time to accept kids who come in emergencies with severe respiratory distress, oxygen saturation is extremely low, and they need prolonged ventilation. Average ventilation is 7 to 14 days that they need, which is very different from anything we saw in any other epidemic like the flu epidemic.
Well, it's important that we realize what is being said here on this panel by both Dr. Ravi as well as Dr. Sonu Udani, because as Dr. Udani and Ravi pointed out, that this was a cohort that didn't really get much attention through the course of the pandemic in 2020, but there is a higher incidence of children being affected, and not just mildly affected, but severely affected, as we've just heard. So we need to be watchful and mindful of this. Let me go across to Kushnuma Kapadia. Kushnuma, many thanks for joining us here on CNBC TV18, and we appreciate the fact that you're here sharing a story, recounting an experience that is distressing to say the least, but hopefully it will benefit other parents who will be watching this program. Kushnuma, take me through what you experienced. You have two children, a daughter who's 16, a son 11. Your daughter tested positive. Your son tested negative, even though he developed symptoms which were later then diagnosed for multiple system inflammatory syndrome. Take me through that experience and what you've discovered along the way.
Yeah, so my daughter tested positive on the 14th of April, and she had very mild symptoms. We isolated her, we quarantined ourselves as well, and it was about eight days after she tested positive that my son woke us up in the middle of the night and said he was feeling really uneasy. And we didn't really anticipate anything serious. We just thought he's probably exhausted simply because he is an energetic child. And after that, the following morning, he developed very, very high fever. And the fever was ranging between 102 and 103. And the fever just, persisted through Friday, Saturday, Sunday. We are not new parents, right? So we just assumed that either, he had a very bad viral infection, or because we already had a child who was COVID positive in the house, it's a natural gravitation of the virus that he had tested positive as well, because the current viral strain is pretty much taking up all families. But what happened is we did a multitude of blood tests on Monday. We did PCR, and like you mentioned, he came negative. So which was really baffling, because then we were like, if he's COVID negative, then what are we dealing with over here? His vitals were not abnormally high either. But what transpired after that was he developed a lymph node on his neck. He had a very bad rash. Like Dr. Udani mentioned, he had severe diarrhea, severe vomiting. He couldn't even retain juice down. And then when we diagnosed his IgG levels, which in his blood report, they were really abnormally high. And which is when, things just took a real turn, and we realized that he had something called multi-inflammatory syndrome in children, and he had to be admitted to the hospital immediately. But until that point, when the symptoms had become really serious, we were just dabbling with whether it was a viral infection with a secondary bacterial infection. We did not anticipate that he was completely asymptomatically COVID positive 4 weeks back. And this MISC is a reaction that transpires 4 weeks after. And which is where my entire endeavor to come into this public domain is that early detection is critical. But aside of that, it's very, very important to create awareness in parents that, this really exists, and it's not just about testing COVID positive or COVID negative. It's the reaction that you have to deal with later, which can become really serious.
Yes, and I'm glad that your son is better. And thank you very much, Kushnuma, once again for sharing your story with us. But Dr. Shivkumar, to Kushnuma's point there, and the condition that she's described is a rare one, so we don't want to put this out as and create any sort of panic. But what are the indications that people should be watchful of if their child were to test COVID positive to ensure that they don't end up in a situation like Kushnuma?
Well, I think the first thing is, like Dr. Sonu was also mentioning, that most of the acute infections that we have seen so far in children are mild. Of course, on this season, they have seen some severe ones, especially some parts of the country. So the first thing that we, as pediatricians, educate the family when we identify that some child has been infected with COVID infection is that when they go home back with recovery, we always advise them to watch out for any recurrence of fever at any point in the 2 weeks to 6 weeks from then on. And we try to educate them on the symptoms that they have to be worried about, development of high-grade fever with rashes. So whenever any of these symptoms develop, we tell them to get in touch with us as quickly as possible. And once we have the history of previous COVID infection, then, we are kind of very focused on investigating for this MIS-C syndrome, which is what one of the parents just described. But the difficulty that we are facing is there are so many kids who are asymptomatic, and parents don't even realize that they themselves or their kids have actually had an infection. So that's where, the media comes into play. It's not, of course, to create panic, but to create awareness that, in this season, if children who are actually staying at home and not going out, they're not getting exposed to infections like what used to happen before this lockdown and quarantine. If they develop high-grade fever, which is not recovering over the next 2 to 3 days, either they have to investigate for the possibility of an acute infection with COVID, or once they get in touch with their pediatrician and physician, as physicians, we are aware about this complication coming up. So it's important that they get in touch with their physicians and pediatricians and explore the options of these possibilities.
Yes, and I would imagine that there is fear as well. So people want to assume that it's just a regular fever, and in many cases it probably is just a regular fever. But given the situation and the current circumstances, the doctors are advising that if there is a high-grade fever for at least 2 days, then it is best that you reach out to your pediatrician, get medical advice and medical intervention if required. But Dr. Ravi, I want to come back to you, and talk to you from the perspective of being a member of the Karnataka COVID task force, for instance. Since you're talking about the fact that we need to be better prepared in anticipation for the third wave, the principal scientific advisor has also cautioned, saying that, look, a third wave is probably inevitable. Are state governments now starting to look at this cohort specifically? Because, our attentions were focused on adults, our attentions were focused on the vulnerable 60 plus. Are state governments, policymakers now starting to look at this cohort as well?
I can definitely tell you from the Karnataka's point of view, the Chief Minister has already constituted a high-level pediatric COVID committee. They will meet soon. It was only decided yesterday. So I'm sure they will start holding their meetings and chalk out a very clear-cut path ahead on both in terms of preparing for clinical management and also look at prevention and maybe engage with the education department, which I think is very important, on whether or not we should go back to regular schooling, or we have to have interrupted regular schooling with online education, or completely online. Because already they have lost 1 year. It has had a tremendous mental health impact. And I'm sure this committee will also have mental health experts, and it should have because children are a different lot and we have to take care of them. One more point I want to say is, apart from this, we are also looking at facing the same challenges we are facing now. So I think that is also important. There are a large number of adults who would not receive vaccine before the next wave is expected, that is towards the end of the year. So I think things like oxygen, beds, drugs, these things also should continue, and we should stockpile them or make them available at a short notice.
Yes, absolutely. I think we should learn the lessons from what we have seen in the second wave. We're out of beds, we're out of oxygen, we're out of key medicines, and I think that this should be something that we address as we prepare. Hopefully, nobody wants to be in the situation of having to deal with a third wave, but it is best to prepare. We cannot live by hope alone. Dr. Udani, I want to come back to you, and several people writing to us with questions asking, if your child does test COVID positive, but the symptoms are mild, perhaps a fever which is about 100 odd or so, and no other respiratory distress, etc., what should the treatment protocol be?
So once again, we must reiterate that in most children, COVID will be a mild febrile illness and will take its course and go away. There will only be a very small percentage who might land up in an ICU and a small percentage who might get MIS. Let's go to the first part, the mild viral illness that children get year-round. COVID presents like that: fever, sniffles, a bad throat, and the child is jumping around between fevers. We don't advise any treatment except the regular paracetamol for the fever. And maybe if you want to supplement your child with some vitamins, vitamin C and multivitamins, they do no harm. There is no other treatment at this stage at all. Remdesivir and all is for a later stage. Hydroxychloroquine, ivermectin, doxycycline, azithromycin, and these cocktails that are given should not be used at all. They are ineffective, and it is not recommended in a child who is mildly asymptomatic to give anything but regular paracetamol. Keep a watch on the child's appetite, the child's hydration status, his activity level, and if necessary, of course, breathlessness is very important, and children manifest easily with that. And if it's possible, check the pulse oximetry once in a while. While I say this, I find that when you advise someone to check pulse oximetry, they're running behind their feisty child with the pulse oximeter every few hours and trying to check the pulse oximeter, and then going crazy because you can get variable readings. So at this point, do a video consult with a doctor, talk to someone, and use a helpline if necessary, and just treat your child as a normal febrile illness. If that same child goes into a high fever for more than 4 or 5 days, or has any other symptoms that we talked about earlier, I'll repeat: severe diarrhea, abdominal pain. And why I say abdominal pain is that we have seen a lot, and it's been reported all over the world, a lot of children with appendicitis coming in the acute COVID stage, diabetes, which was never there, of course, infantile diabetes, flaring up or manifesting itself is the first time during a COVID infection, persistent vomiting, fast breathing. Do not be in denial. Do not start phoning. Just go to the closest hospital or the clinic facility that you have and get your child examined. Most children will be well and happy. Very few will require the second step.
Yes, very few will require the second step, but if you notice any of the symptoms that you just heard Dr. Udani take us through, then please get yourself to a doctor as quickly as possible. Dr. Shivkumar, let me ask you this, and many people are writing into us saying that, for instance, is it safe to get an antibody test done for children to find out if they've had any exposure or not to somebody who was COVID positive? Would you recommend that?
I mean, the question is, what are we trying to achieve by doing the antibody test? I don't think if you're looking at trying to see if once you have had an infection. So the antibody tests will be positive, meaning you'll find COVID antibodies in children if they're previously infected. But that neither means that they cannot have a second infection, nor does it mean that anything needs to be done about it. So it's just unnecessary involves taking them to a lab where, nowadays there's so much crowd and you're unnecessarily exposing them by taking them outside. At the same time, the test per se does not give you any added value. So we would strongly recommend against any such, adventures, to be more precise.
Yes, you're right in pointing out, avoid such adventures. They're really not necessary at this point in time. But anything from a prevention perspective that you would like parents to keep in mind, Dr. Shivkumar?
I think the best prevention now is, taking care of hygiene, using a mask, maintaining distance, washing hands. That's probably the best thing that you can do. And now that the schools are not functional, they're not getting exposed to going outside. And also children are not, playing with their peers, which is, of course, not a welcome thing to happen. But in the given circumstances, I think since they're locked in their homes, that's probably the safest place for them to be. But at the same time, I think the other best preventive thing that we can do for our children is to keep ourselves safe from infection with responsible behavior. These are the only things that are available right now until the time that, we strike up on some vaccine which can be given to children, which will be a big help for them from getting infected.
Well, that is something that the world is waiting for at this point in time. But, and that will perhaps also help us chart out a strategy as far as reopening schools are concerned. And that is crucial. It's important. Kids have been out of school for a year now. And as we get out of this second wave and anticipate the third wave, we will need to understand and chart out a strategy of how we get kids back to school in some form or fashion, to the point that Dr. Ravi was making. Kushnuma, before I let you go, what has this experience taught you? How has it changed the conversations that you're having with your children, for instance?
Actually, I'm also of the opinion that one doesn't really need to dwell on the entire negative aspect of what we experienced as a family. When my son came back from the hospital and when I penned that letter, which I didn't anticipate was going to go this viral, my one thing to him was that if he's gone through this entire painful experience, and how do we really convert it into a positive experience? And the only way we could have done that is used his experience as a platform to create that kind of knowledge and that kind of awareness. Like I have consistently maintained, I'm not a doctor. I am the wife of a medical professional, but I'm only talking from the point of view of a mother, and my entire endeavor was that at least put this syndrome in the spotlight, because I wasn't aware of it, right? And if it's out there, people are at least watching out for the red flags. And if it really saves even one life, I think it was really worth the pain and the anguish that we went through as a family and what my son experienced. And I think that's my message to him, as well as my endeavor through, just reaching out with my own private. Actually, it's a very personal experience, but I think this is the time we need to come together as a community.
Absolutely. And, I appreciate the fact that you have gone public with a very difficult personal experience in the hope that this will, in fact, get people to understand that there is such a condition and be ready for it. This is not an attempt to say that every child who gets infected with COVID is necessarily going to land up in that situation, but it is something that we need to be mindful of. Dr. Ravi, Dr. Sonu Adani, Dr. Shivkumar Shamarao and Kushnuma, appreciate you joining us here on CNBC TV18's COVID Helpline to take us through what parents should keep in mind on the watch list as we go through the second wave, and what we should anticipate and prepare for as we move forward. Thanks very much for your time. Appreciate it. We'll take a break. There's a lot more coming up. Don't go anywhere. We're back.